Hip external rotation 90-90 pails and rails. The 90-90 position refers to the angle of your knees. Therefore, each knee should be at 90 degrees. This stretch will be very beneficial when there are limitations of mobility in the joint capsule and can eliminate low back pain that is related to hip immobility. For the external rotation, we will be focusing on the front leg. If your back leg is uncomfortable, slight adjustments can be made as this is not the leg that will be focused on. If you have pinching or cramping that persist in the back hip joint within the upright position, slight angle adjustments of the torso can be made. Begin by slightly leaning towards your front leg, attempting to get your belly button to your knee. It may help to slightly bow your back or tilting your pelvis forwards. Ensure that your chest remains upright and the only adjustments are with your hip rather than rounding your back. You should begin to feel a pulling in the deep tissues at the back of the hip. Once end range is achieved, hold a passive stretch for 2 minutes. Begin the Pails contraction by creating tension throughout your upper body. You want to push your hands down into the floor along with the foot, knee, and calf of the front leg. Slowly build this contraction over 5 seconds, and then at the peak tension, hold this 10-second maximal contraction, again pushing your front calf, foot, and knee into the floor. This is then followed by the rails contraction, where you will attempt to lift your front foot from the floor. This will result in your chest sinking lower towards your knee. Again, you will want to build this contraction over a 5-second period, ramping up to peak tension for a 10-second maximal contraction. After this is completed, you will hold this new end range passively for 2 minutes. This cycle can then be repeated, ensuring that both legs are being stretched. While doing these stretches, ensure that no pain persists when there are passive ranges of motion. Or, if pain is too great when contracting, stop the exercise and ask a therapist if this stretch is right for you. Any questions about angular isometric stretching should be directed towards a therapist or a professional within this field.